Good day, everyone. I am Angel Bertlin T. Campus from BSN 1-2 of Isabela State University at Tiaga Main Campus. For today's video, you will be joining me in performing a return demonstration on the assessment of the hair, skin, and nails of a patient. Prior to the conduct of the procedure, and before we do a direct contact with the patient, make sure to perform a proper hand hygiene and wear PPE to prevent and avoid any cross-contamination since all body fluids are considered as contaminated. Now, our next procedure is to gather the materials we will be needing in the assessment. So the first one is a pen light that is used for adequate lighting, a metric ruler or a tape measure that is used to measure the size of the skin lesion, any discoloration, or abnormalities of the skin of the patient. And next is the gloves used to protect the hand. And this is an examination gown used by the patient for his protection and any exposure. So now we are ready to continue our assessment. The first thing we must do is to introduce ourselves to the client, identify our client, and ask how he wants to be addressed. So good morning, sir.
Good morning.
I am Angel Bertlin T. Campus, a student nurse for today. So what is your name, sir? May I ask?
John Mark Del Monte.
John Mark Del Monte. Your middle initial, sir?
Kalema.
So how old are you now, sir?
20 years old.
Okay, sir. Kindly check your information. Thank you, sir. So, what do you want me to call you, sir?
Just call me JM.
JM, okay. Thank you, Mr. JM. So, our next thing is to explain to the client the what or how important is the examination or assessment is to his health and to his body. Okay, Mr. JM or Sir JM, I am here today to assess your skin, hair, and nails to ensure that they are in normal state and to see if there are any presence of abnormalities such as the abrasion, discoloration, and lesion so that we can avoid further complications. Okay, so do you have any question before I proceed to the assessment, sir?
Nothing.
Okay, sir. Then if you do have any questions, you can ask me throughout the assessment.
Okay.
So then we will ask the client if what are we going to do is okay to him or approved him, and tell the client all the data will be confidential. Okay, Sir JM, I will be doing a physical examination on you, which includes exposing some of parts of your body and me touching some parts of your body. Would that be okay with you, sir?
Okay.
Okay, thank you, Sir JM. Rest assured, Sir JM, that the result in the assessment is just between you and me and the physician or the attending physician. Okay, now we will ask the clients to wear the examination gown for easily access of the examination. So, sir, may I ask you to wear this examination gown to prevent exposure of the parts of your body that is not needed for this physical examination. We also need to provide privacy to the clients by closing the doors and the curtains. And since the door is closed, we will only be closing the curtains here. So the patient will be sitting, will be in sitting position throughout or most part of the assessment. For the first part of the assessment, inspection must be done to see the condition of the client's skin. So, sir, JM, may I ask you to lift up your hands? Thank you, sir. So, note for any distinctive color from the patient's skin, and if there is none, you can now proceed in inspecting the client's skin color. We are inspecting the skin to look for sign of discoloration such as brownness, redness, yellow pallor, cyanosis, jaundice, erythema, and vitiligo, because it may be indicated as abnormalities. Okay. As I am assessing my client, thank you, sir, I I noticed that the skin ranges from light to moderate brown, which is normal, and there is no presence of discoloration or abnormalities. We'll also check for the skin's integrity. Sir, can you lift up your hands again for me to inspect the condition of your skin? Like this again, sir. Same as the first one. So, we will be inspecting any skin breakdowns, such as insect bites, cuts, wounds, bruises, or scratches, because it can be considered as skin abnormalities. Then inspect for any presence of the skin lesion that can be classified into primary lesions such as macules and papules, and secondary lesions such as the pressure ulcer or the fissure, vascular lesions such as hematoma and angiotoma, and in worst case scenario, it can be a skin cancer. And if there are skin lesions, we need to take note to that together with the size, shape, location, distribution, and configuration. As I am assessing my client's skin, thank you again, sir, I see that there is no presence of any skin lesion or the skin breakdown which is good and sign of normal. If there are any skin lesion on the clients, we will be wearing gloves, but since none, we will not be using the gloves. We will be using gloves and palpate the lesion between the thumb and the index finger to know its size, mobility, consistency, I should say, and tenderness. The next is to palpitate the skin texture, if it is rough or smooth, and to palmar surface of the three middle fingers. So now, sir, can I touch and palpate your skin to know its texture?
Okay.
So, as I am assessing, as I am assessing my client's skin texture is smooth, and that is a good. But the client's skin should not be too smooth or too dry because that is a sign of abnormalities. So I will be palpitating the skin for temperature and moisture using the dorsal aspect of the hand because it is more sensitive in temperature than in the anterior aspects of the hand. Why? Because this dorsal hand is thinner in skin than in anterior. Okay. Sir JM, I will gonna touch your forehead and arms to feel your temperature and moisture. Would that be okay, sir?
Yes, okay.
Okay, thank you, Sir JM. So palpitating the skin for temperature, whether the client is cold, warm, or hot, may give us hint if the client has a fever or suffering from infection. So remember that the moisture on the skin and moisture on the axilla is normal, but any signs of excessive dryness or excessive moisture is already abnormal. And we need to take note of that. Okay, so as I am assessing my client, so he was in a warm temperature and he has no signs of fever and infection and has no excessive dryness, oiliness, and sweating of the skin, which indicated as a good sign that his moisture is not too much. So now is our next assessment is to palpitate the thickness of the skin by pinching the client's skin. So as Sir JM, may I ask you if I can pinch your skin just to make sure its thickness? So sir, may I? Okay. So upon pinching my client's skin, his skin is indeed thick. So we'll also palpitate mobility and turgor by pinching up the skin over the sternum, and we just need to expose the part just below the clavicle of the client. Okay, so Sir JM, may I request you to please just put, or if you don't mind, I will be exposing your skin below your clavicle, and allow me to pinch it to check your skin mobility under. Okay, sir. Note that if the skin returns immediately to the normal, then there is an absence of skin turgor. But if not, the skin turgor is present, and it may be a sign of dehydration. So, if there is a sign of dehydration, the patient must be drinking some water to bring back his or her hydration. So, thank you, sir. So, as I am assessing my client, there is his skin returns back to normal immediately. So, it indicated that there is an absence of skin turgor and he is hydrated. So now, next is to ask the client to bring his or her foot to the lap in order to palpitate for edema by pressing the thumb and by putting pressure on the skin over the feet. Okay, so sir, may I ask you, Sir JM, may I ask you
Yes.
to lift up your right foot?
Okay.
So in assessing edema, if the skin becomes intended, it means that there is a sign of edema. But if the skin quickly returns to normal, then there is no sign of edema. Okay. Okay, thank you, sir. So, sir, may I have your other foot, your left foot, sir? Thank you, sir. So, as I am assessing his right foot, there is no presence of edema. And as I was assessing this left foot, his skin returns into normal state, which indicate that he has no presence of edema. Thank you, sir. So the assessment of the skin is done, sir, and its overall condition is a good sign and as indication that the client, has no sign of infection, skin disease, and skin cancer. Thank you, sir. After assessing the client's skin, we will now proceed in examining the client's nail. Okay. So, sir, I will be now examining your skin, your nails, I should say, sir. So, Sir JM, may I ask you to lift up your nails? Thank you, sir. So, the first thing we need to inspect is the nail grooming and nail cleanliness because cleanliness is the line of defense against harmful bacteria that can cause illness. So, as I am assessing my client, I must say that his hands are well groomed and clean. So, next is to inspect the client's amount and marking since it will help in determining whether the client is ill or not. So, we will be taking down notes, the client's nail shape, and if there is a sign of clubbing or blue slimes on the nails. So, as I am inspecting, my client's nails are really well groomed and clean, and there is no signs of abnormalities. And his nails are really good. His nails skin are really good. Okay, thank you, sir. Okay. The next method in assessing the nail is to palpate for texture and consistency to ensure that the client's nail, or I should say client's nail plate, is attached to the client's nail bed. So, sir, may I ask you to lift up again your hand? And I will be checking your nails again to make sure that your plate are intact. Could you lift up, please? Okay, so now we will be checking up or testing for capillary refill by applying pressure into the nail tip and watch for the color to change. If the color returns quickly to normal, that means, sir, that it has a faster fills and your client or your nail, sir, is normal. But when the color is slowly returns to normal, it only means that it refills slowly and it can be an indication of cardiovascular or any respiratory disease, sir, that may lead to hypoxia. So, sir, may I ask if I can, or would it be okay, sir, if I will apply a pressure to your nails or to your nail tips to know if you have a fast refill capillary or a slow refill? Thank you, sir. So, So as I am assessing my client's nail, it seems that the nail plate are intact to its nail bed. Oh. And he has a fast reveal capillary, which is an indication of nail or of normal nail. Okay, thank you, sir. So we are now done in assessing your nails, sir. Do you have any question?
Nothing.
So that is how we perform or we assess the nail of a client. So after performing the assessment of client's nail, we will now proceed in assessing his hair. So we will now assess the client's hair and scalp, but to make sure to put gloves on to prevent cross-contamination. So I will be putting my gloves to prevent cross-contamination. So you can use a surgical gloves, for it is most recommended in performing this kind of medication or this kind of assessment. Okay, after putting, so sir, I will now assess your hair and scalp, Sir JM, to see if there are any abnormalities. Okay, sir?
Okay.
Is it okay, sir?
Okay.
Okay, thank you, Sir JM, for that very aggressive response. So the first thing we need to inspect is the color. Color of the hair as well as the scalp to know the client's hair and scalp condition. So next is to inspect the amount and distribution of the hair to make sure it is evenly distributed or not. But if it is not, you will have to take note of the area and the diameter of the affected area. So now we will also inspect and palpate for the thickness, texture, oilness, lesion, if there is any, and parasite among the client's hair and scalp. And we will also take note for that abnormalities. So I'm still assessing. So as I am assessing my client, I noticed that the hair color is black. Thank you, sir, for giving me authority. So as you can see, or as I examine my client, his color is color black. His hair color, I should say, is black, and there is no presence of lice. Among his scalp, there is no other lesion and flaking, which is an indication that the scalp is intact. And that is a good indicator. And that my client, sir, your hair is evenly distributed, thick, not too dry and not too oily. It only means that my client's hair is in normal state. So that's all, sir, Sir JM. We are finally finished in assessing your hair, and I think everything is good to you. So as your skin and nails. Thank you for your cooperation, Sir JM. So the data noted in assessment are completely confidential between me and the attending physician and to you. I will refer it all on my observation to your doctor, sir, for further evaluation. So after the procedure, we need to properly disregard the gloves that we uses. So this is the gloves that I uses. We will be putting it in trash can or trash bin, and we need to perform a hand hygiene to protect our cells from the bacteria or the contamination. And that is how we perform our skin, nail, and hair assessment to our client. Again, I am Angel Bertlin T. Campus, your student nurse of BSN 1-2 of Isabela State University. Thank you so much for watching.